What our primary goal with our patients is to be able to improve their quality of life by improving their function, reducing their pain, their need for medications, and possible surgery. We have a few options of doing that. One is using traditional methods, or we can use advanced cutting-edge technologies. And as part of the advanced cutting-edge technologies, we have the ability to use what's called umbilical cord tissue, which has stem cells, growth factors, and exosomes. Now, these are FDA cleared to be used under experimental observational use model, is what we do here in the office. Our goal with this is to reduce the patient's degree of inflammation. So with most disease processes, they're all based in an inflammatory mechanism. So if we can reduce that naturally, we're going to put the body in a better healing scenario so the body can heal on its own. The problem is most methods that they use in medicine in order to treat inflammation comes with significant side effects, and these include prednisone, steroids, non-steroidal anti-inflammatory drugs. These are very powerful drugs which will initially reduce the inflammatory mechanism. However, the long-term consequence of that is going to cause more tissue destruction, basically causing that joint to break down even more. So applying these collagen-based growth factors, which will help to repair the joint on a cellular level, we will eventually get improved function of that joint and improved quality of life. And this is something that we see with our patients consistently with our observational use model.